What does the term pharmacokinetics refer to in pharmacology? A. How drugs are metabolized in the body. B. How drugs affect the body. C. How drugs are absorbed, distributed, metabolized, and excreted in the body. D. How drugs are manufactured in the laboratory. The correct answer is C. Pharmacokinetics refers to how drugs are absorbed, distributed, metabolized, and excreted in the body. Which of the following is not a phase of pharmacokinetics? A. Absorption. B. Distribution. C. Concentration. D. Excretion. The correct answer is C. Concentration is not a phase of pharmacokinetics, but rather a result of the processes of absorption, distribution, metabolism, and excretion. Which of the following factors can affect drug absorption in the body? A. Route of administration. B. Age of the patient. C. Presence of food in the stomach. D. All of the above. The correct answer is D. Factors such as the route of administration, age of the patient, and the presence of food in the stomach can all affect drug absorption. Which of the following organs is primarily responsible for drug metabolism in the body? A. Heart. B. Kidneys. C. Liver. D. Lungs. The correct answer is C. The liver is the primary organ responsible for drug metabolism in the body. What term describes how a drug moves from where you give it into the bloodstream? A. Distribution. B. Absorption. C. Metabolism. D. Excretion. The correct answer is B. Absorption is the process by which a drug is moved from its administration site into the bloodstream. Which of the following factors can affect the distribution of a drug in the body? A. Blood flow to tissues. B. Protein binding. C. Tissue permeability. D. All of the above. The correct answer is D. Blood flow to tissues, protein binding, and tissue permeability all affect drug distribution in the body. What term refers to the process by which a drug is removed from the body? A. Distribution. B. Absorption. C. Metabolism. D. Excretion. The correct answer is D. Excretion is the process by which a drug is removed from the body. Which of the following routes of drug administration typically results in faster absorption compared to oral administration? A. Intravenous. B. Oral. C. Topical. D. Rectal. The correct answer is A. Intravenous administration typically results in faster absorption compared to oral administration, as the drug enters directly into the bloodstream. What is the term for the process by which a drug is broken down in the body into smaller molecules that can be eliminated? A. Distribution. B. Absorption. C. Metabolism. D. Excretion. The correct answer is C. Metabolism is the process by which a drug is broken down in the body into smaller molecules that can be eliminated. Which of the following factors can affect the excretion of a drug from the body? A. Kidney function. B. Liver function. C. Urinary pH. D. All of the above. The correct answer is D. Kidney function, liver function, and urinary pH all affect how the body excretes a drug. Which term describes the study of how drugs move through the body, including absorption, distribution, metabolism, and excretion? A. Pharmacodynamics. B. Pharmacokinetics. C. Pharmacogenetics. D. Pharmacovigilance. The correct answer is B. Pharmacokinetics is the study of how drugs move through the body, including absorption, distribution, metabolism, and excretion. Which factor can influence the bioavailability of a drug in the body? A. Gender. B. Weight. C. Food intake. D. Blood pressure. The correct answer is C. Food intake can influence the bioavailability of a drug in the body by affecting its absorption rate and extent. Which organ is primarily responsible for drug excretion in the body? A. Kidneys. B. Liver. C. Lungs. D. Heart. The correct answer is A. The kidneys are primarily responsible for drug excretion in the body, filtering waste products and drugs from the bloodstream to be eliminated in urine. Which route of drug administration bypasses the liver's first-pass metabolism, leading to quick absorption? A. Intramuscular injection. B. Sublingual administration. C. Inhalation. D. Oral administration. The correct answer is B. Sublingual administration bypasses the liver's first-pass metabolism. This leads to rapid drug absorption through the mucous membranes under the tongue. What process turns a drug into easier to remove substances? A. Distribution. B. Absorption. C. Metabolism. D. Excretion. The correct answer is C. Metabolism is the process of converting a drug into metabolites through enzymatic reactions, making the drug more water-soluble for elimination from the body. Which factor can alter the volume of distribution of a drug in the body? A. Age. B. Race. C. Smoking status. D. Temperature. The correct answer is A. Age can alter the volume of distribution of a drug in the body, as changes in body composition and organ function can impact drug distribution. Which phase of pharmacokinetics involves the breakdown of a drug into metabolites by enzymes in the body? A. Absorption. B. Distribution. C. Metabolism. D. Excretion. The correct answer is C. Metabolism is the phase of pharmacokinetics that involves the breakdown of a drug into metabolites by enzymes in the body, primarily in the liver. Which factor can impact the drug's half-life in the body? A. Drug dosage. B. Liver function. C. Heart rate. D. Urine pH. The correct answer is B. Liver function can impact the half-life of a drug in the body, as the liver's metabolic capacity influences the rate at which drugs are broken down and eliminated. What term describes the time it takes for a drug's plasma concentration to drop by half after it's given, affecting how often you dose it? A. Bioavailability. B. Distribution. C. Half-life. D. Clearance. The correct answer is C. Half-life refers to the time it takes for a drug's plasma concentration to decrease by half after it's given. This helps determine how often to give the drug and how it's eliminated from the body. Which of the following best describes clearance in pharmacokinetics? A. The rate at which the drug is removed from the body. B. The initial concentration of the drug in the body. C. The potential side effects of a drug. D. The time required for a drug to reach peak concentration in the body. The correct answer is A. Clearance. In pharmacokinetics, refers to the rate at which a drug is removed from the body. What is the term used to describe how a drug becomes active in the body? A. Distribution. B. Excretion. C. Activation. D. Elimination. The correct answer is C. The process by which a drug is metabolized into its active form in the body is known as activation. Which of the following factors can influence drug metabolism? A. Age. B. Smoking habits. C. Blood type. D. Hair color. The correct answer is A. Age is a factor that can influence how the body processes a drug. What is the term for the amount of drug given to get the desired medical effect? A. Elimination. B. Bioavailability. C. Therapeutic dose. D. Minimum effective concentration. The correct answer is C. Therapeutic dose refers to the amount of a drug given to achieve its intended effect in the body. Which of the following routes of drug administration is commonly associated with the lowest bioavailability? A. Intravenous. B. Intramuscular. C. Subcutaneous. D. Oral. The correct answer is D. Oral administration is commonly associated with the lowest bioavailability due to factors such as first-pass metabolism and absorption limitations. What is the name of the process where a drug is chemically changed in the body to become inactive and get removed? A. Distribution. B. Inactivation. C. Metabolism. D. Absorption. The correct answer is B. Inactivation is the process where a drug is chemically altered in the body into an inactive form for elimination. Which of the following organs is primarily responsible for drug bioactivation in the body? A. Liver. B. Kidneys. C. Lungs. D. Skin. The correct answer is A. The liver is primarily responsible for drug bioactivation in the body. Which term refers to the maximum drug concentration in the body after a single dose? A. Peak plasma concentration. B. Half-life. C. Onset time. D. Steady-state concentration. The correct answer is A. Peak plasma concentration refers to the maximum concentration of a drug in the body after administration of a single dose. What is the term for how a drug spreads evenly throughout the body? A. Metabolism. B. Absorption. C. Distribution. D. Excretion. The correct answer is C. Distribution is the term used to describe the process by which a drug is evenly distributed throughout the body's tissues and fluids. In pharmacokinetics, what's the name of the process where a drug molecule binds to proteins in the blood, impacting its distribution and availability? A. Proteinuria. B. Protein binding. C. Lipid solubility. D. Capillary action. The correct answer is B. Protein binding is the process where a drug molecule binds to proteins in the blood, impacting its distribution and availability for action. What is the primary route of drug metabolism in the body? A. Kidneys. B. Liver. C. Lungs. D. Stomach. The correct answer is B. The liver is the primary organ responsible for drug metabolism through various enzymatic processes. Which factor can affect the bioavailability of a drug in the body? A. Age of the patient. B. Gender of the patient. C. Food in the stomach. D. Environmental temperature. The correct answer is C. The presence of food in the stomach can affect the absorption and bioavailability of certain drugs. Which route of drug administration bypasses the liver's first-pass effect, leading to rapid drug absorption? A. Subcutaneous injection. B. Intravenous injection. C. Intramuscular injection. D. Rectal administration. The correct answer is B. Intravenous injection bypasses the first-pass effect by delivering the drug directly into the bloodstream. What process converts a drug into metabolites for the body to eliminate it? A. Absorption. B. Excretion. C. Distribution. D. Metabolism. The correct answer is D. Metabolism is the process by which drugs are broken down into metabolites that can be easily eliminated from the body. Which term describes the process of a drug moving across cell membranes into the bloodstream? A. Absorption. B. Distribution. C. Metabolism. D. Excretion. The correct answer is A. Absorption refers to the process by which a drug is moved from its site of administration into the bloodstream. What factor can alter the volume of distribution of a drug in the body? A. Drug metabolism rate. B. Protein binding. C. Half-life of the drug. D. Food intake. The correct answer is B. Protein binding can significantly impact the volume of distribution of a drug within the body's tissues and fluids. Which term describes the process by which a drug is removed from the body? A. Absorption. B. Distribution. C. Metabolism. D. Excretion. The correct answer is D. Excretion refers to the process by which drugs and their metabolites are eliminated from the body. Which factor can influence the half-life of a drug in the body? A. Drug dosage. B. Frequency of drug administration. C. Metabolic clearance rate. D. Renal function. The correct answer is C. The metabolic clearance rate can significantly impact the half-life of a drug in the body. What is the term for how long it takes a drug's plasma concentration to drop by half after you give it? A. Half maximal dose. B. Therapeutic window. C. Half-life. D. Minimum effective concentration. The correct answer is C. Half-life is the time it takes for the plasma concentration of a drug to decrease by half. Which phase of pharmacokinetics involves the drug's distribution throughout the body's tissues and fluids? A. Absorption. B. Metabolism. C. Distribution. D. Excretion. The correct answer is C. The distribution phase of pharmacokinetics involves the movement of a drug throughout the body's tissues and fluids. Which of the following factors can impact the bioavailability of a drug in the body? A. Route of administration. B. Metabolism rate. C. Excretion process. D. Protein binding affinity. The correct answer is A. Bioavailability refers to the fraction of a drug dose reaching the bloodstream unchanged. The route of administration significantly impacts how much drug is absorbed and reaches the bloodstream. What is the primary organ responsible for drug metabolism in the body? A. Kidneys. B. Lungs. C. Liver. D. Pancreas. The correct answer is C. The liver is the primary organ responsible for drug metabolism, where enzymes break down drugs into metabolites that can be eliminated from the body. Which route of drug administration is typically faster than subcutaneous? A. Intramuscular. B. Topical. C. Inhalation. D. Transdermal. The correct answer is C. Inhalation typically results in faster absorption compared to subcutaneous administration, as the drug can directly enter the bloodstream through the lungs. What term describes how a drug leaves the body without much breakdown? A. Excretion. B. Distribution. C. Bioactivation. D. Metabolism. The correct answer is A. Excretion is the process by which a drug is eliminated from the body without undergoing significant metabolism, usually through the kidneys or bile. Which of the following factors can affect drug distribution in the body? A. Half-life of the drug. B. Protein binding affinity. C. Volume of distribution. D. Metabolism rate. The correct answer is B. Protein binding affinity can affect how a drug spreads throughout the body. Drugs bound to proteins may not be easily available to work or reach tissues. What is the primary route of drug excretion in the body? A. Kidneys. B. Liver. C. Lungs. D. Skin. The correct answer is A. The kidneys are the primary route of drug excretion in the body, filtering drugs and their metabolites from the bloodstream into urine for elimination. Which phase of pharmacokinetics involves the drug moving from where you take it into the bloodstream? A. Distribution. B. Metabolism. C. Excretion. D. Absorption. The correct answer is D. Absorption is the phase of pharmacokinetics involving drug movement from its administration site into the bloodstream. This allows for further distribution and metabolism. Which factor can influence the volume of distribution of a drug in the body? A. Metabolism rate. B. Protein binding affinity. C. Excretion process. D. Lipid solubility. The correct answer is D. Lipid solubility is a factor influencing a drug's volume of distribution. This affects how widely and where the drug spreads throughout the body's tissues and fluids. What process breaks down a drug into metabolites using enzymes in the body? A. Distribution. B. Metabolism. C. Excretion. D. Bioactivation. The correct answer is B. Metabolism is the process by which enzymes break down a drug into metabolites that can be further processed for excretion or inactivation. Which of the following best describes clearance in pharmacokinetics? A. The rate at which a drug is distributed to target tissues. B. The process of drug elimination from the body. C. The fraction of an administered dose that reaches systemic circulation. D. The time it takes for the plasma drug concentration to reduce by half. The correct answer is B. Clearance. In pharmacokinetics, refers to how the body eliminates a drug. This usually involves metabolism and excretion. Which of the following factors can impact the rate of drug absorption in the body? A. Food intake. B. Gender. C. Eye color. D. Height. The correct answer is A. Food intake can influence drug absorption by affecting the gastric emptying rate and the stomach's pH, among other factors. What term describes a drug's movement from the bloodstream into the body's tissues and organs? A. Excretion. B. Distribution. C. Metabolism. D. Absorption. The correct answer is B. Distribution refers to the movement of a drug to various tissues and organs in the body after it's been absorbed into the bloodstream. Which of the following routes of drug administration typically has the slowest absorption rate? A. Intramuscular injection. B. Intravenous injection. C. Sublingual administration. D. Rectal administration. The correct answer is D. Rectal administration typically has a slower absorption rate compared to intravenous or intramuscular injection. Which phase of pharmacokinetics involves the breakdown of a drug into metabolites that can be excreted from the body? A. Metabolism. B. Absorption. C. Distribution. D. Excretion. The correct answer is A. Metabolism is the phase where a drug is broken down into metabolites by enzymes in the body for elimination. What factor impacts a drug's plasma concentration over time by changing its elimination rate? A. Absorption rate. B. Distribution rate. C. Metabolism rate. D. Excretion rate. The correct answer is C. Changes in metabolism rate can influence how quickly a drug is broken down and eliminated from the body, affecting its plasma concentration over time. In pharmacokinetics, what's the term for how a drug moves from where you give it to the bloodstream? A. Excretion. B. Absorption. C. Metabolism. D. Distribution. The correct answer is B. Absorption refers to the movement of a drug from its administration site into the bloodstream. Which of the following organs is primarily responsible for drug metabolism in the body? A. Kidneys. B. Liver. C. Lungs. D. Stomach. The correct answer is B. The liver is the primary organ responsible for drug metabolism, where drugs are broken down into metabolites that can be excreted from the body. What term describes how a drug spreads evenly throughout the body? A. Absorption. B. Distribution. C. Metabolism. D. Excretion. The correct answer is B. Distribution refers to the spread of a drug throughout the body's tissues and fluids after it's been absorbed into the bloodstream. Which factor alters a drug's bioavailability by affecting how much of the dose reaches the bloodstream? A. Age. B. Blood pressure. C. Hair color. D. Smell sensitivity. The correct answer is A. Age can impact how well the body absorbs and uses a drug. This is because things like digestion and liver function change as we get older.